Good evening. We have with us our Student Services Director, Tony Boyden, who is going to be sharing some information, and several of our partners are here as well. And she's going to be sharing information about school-based mental health partnerships so that we have a better understanding of the important work that they are all doing in partnership with our school district on behalf of our students. Thank you all for being here.
Good evening. Good evening, Chair, School Board, Director Salo, Dr. Salo. My name is Tony Boyden. I'm the Director of Student Services, and I am here today to talk about school-based mental health services. I would like to introduce my partnership and agency. I'm going to pass the microphone, and they can tell you where they're from and what their names are.
Good evening. My name is Jamie Munson. I'm the Director of Behavioral Health for Volunteers of America of Minnesota and Wisconsin.
Hi, I'm Tiffany Johnson. I'm the Associate Director of Behavioral Health at Vona Center for Mental Health by VOA as well.
Bruce Cross with People Incorporated.
Hi, I'm Sarah Benson. I'm also with People Incorporated, and I'm the Director of Children's Mental Health.
Okay, I just want to take one moment and look at the mission of Robbinsdale Area Schools. Our mission of Robbinsdale Area Schools is to inspire and educate all learners to develop their unique potential and positively contribute to their community. So the reason I asked to come today is because in this time of turmoil and time of change, I thought it was really important that we celebrate something that is so spectacular and that Robbinsdale is a founder for, and that is our school-based mental health services. This is a 25-year partnership, if not longer, and we were one of the founding people to incorporate therapists into our schools in Minnesota. So why I thought this was important is because our students have support. Our students are going through grief, they're going through change, they're going through excitement, and we do have people to help them support them during this time. So currently we have partnerships with People Incorporated, VEMA, and Vona. And we have a grant that helps to pay for this. It does not come out of our operating budget. So the requirements of the grant are to work collaboratively with school districts to ensure services are coordinated and integrated, provide mental health services throughout the calendar year, collect and report evaluation data to DHS on a quarterly basis, and bill all available public and private insurance for clinical services. So the role of our school-based mental health services is to improve identification children and youth with mental health needs and disorders, to increase mental health services to sustain engagement by removing barriers, improve outcomes for students with mental health diagnosis, provide coordination of care between school staff and mental health providers, and increase accessibility for children and youth that are uninsured or underinsured. The student referral process is very simple. Anyone can refer a student for services, parent, school staff, a student themselves. We contact the agency and the agency will follow up with the families. An intake is scheduled. An introductory complimentary conversation occurs between the agency and the family. A treatment plan is created. A diagnosis assessed if needed. Consent is signed and sessions begin. Our therapy in the schools, there is 1.0 in each of our buildings, with the exception of one building at a 0.75. Each therapist carries approximately a caseload of 20-25 students. Students are serviced an average of 1 time per week. Some extreme cases are 2 times per week, and sometimes when progression is occurring, it's dropped down to biweekly. Group therapy and family therapy are offered and provided, and outpatient therapy is also available. Currently, the numbers we are serving, and I'm going to, the slide is a little bit different, between all 3 agencies, our children served district-wide is 459 students. The referrals that have been made this year are 496. Referrals that didn't become clients are 167. And completed services, students that were discharged, are 153. We do offer therapy throughout the summer, again, part of our grant for year-round. Therapists go to the homes, they meet students in public places, they go to the houses, they go to Adventure Club, and they attend field trips. In addition, they have collaboration with our buildings. They are part of the MTSS group. They provide training to the staff. They do a lot of coordination with their social workers. They have quarterly meetings with the buildings and with myself. They attend IEP meetings and they attend parent meetings. So again, a celebration of what we have for our students on site.